Yeah, hello and welcome to the case of the month in December 2021. Last case of the month, I think, for this year, maybe. And it's a very, very simple case, very classically solved, classic prosthodontic case. And as always, big thanks goes to technician Elena Kalb from Munich. And she's done very well here. And I've made a few mistakes in this case that I'll show you. But I think overall the case has been solved rather nicely. Patient, you can see already the classic combination of psychological problems, heavy grinding, and the anatomical changes. So this patient had some trouble in her life and sorted that out after maybe 10-15 years, and wanted to have nice teeth again, and was stable now. And you can see the 10-15 years of trouble have caused quite significant damage to the dentition. You see the classical combination of very, very short front teeth, and in some cases, like in this case, the teeth, the vertical bite is not lost, but not entirely lost, but the front teeth just grow down, get shorter, and then additionally you have hypertrophic bone, so more bone growth, and then as well a little bit thicker tissue. If you compare, for example, here on the next picture, the tissue of the front teeth with the tissue of the posterior teeth, you can see that the front thickness of the attached gingiva is much more. The bone is more. So this is the reaction to the stress of the grinding. So the way we solve this case is actually very simple. Posterior teeth, the gingiva line looks okay, no gum disease. We just lift the bite a little bit, restore the occlusal surfaces again, try to take off the stress a little bit of the posterior teeth and the front teeth, of course, as well. Try to lift the bite, because here at the moment you see that's a very deep bite. We don't want that. We don't want the patient, if the patient grinds, can easily glide out of their habitual intercuspidation, that means of their occlusion. And classic wax up sometimes makes my heart bleed if I see that. This is the way I learned it 10-15 years ago. Now everything, of course, is digital. So this case is 2 years old. Technology has changed a lot. So we don't do any manual wax ups anymore. It's all digital now. But in this case, like I said, it's 2 years old. So manual wax up from the occlusal view and the front view. So we know where we roughly want to end up. And then, because of the patient's limited financial abilities, we decided to do direct composite fillings on the posterior teeth. Here the preparation for that, and gets additional crown on the upper left first molar, and the four front teeth, or the 6 front teeth will get veneers. Good. Here, next picture, then the teeth fillings have been placed. Very simple fillings, no coloring, no nothing. Just making sure that we lift the bite. It's actually, I think, a job of 2 hours or something. And luckily for me, directly after removing the rubber dam and having them polished, this was the bite. So I was very happy and very pleased with it, that we had contact on all teeth, and that was lifting the bite done. And we lift the bite around 2 millimeters. Then we had to take care of the front teeth. Now the bite stabilized, patient can grind better, less stress on the joints, can focus now on the front teeth. So next session was just rough preparation of the front teeth and getting a temporary done according to the wax up. Very, very simple. I wanted that to make sure that we know our next step, and our next step is the so-called apical repositioned flap. We raise a full flap and recontour the entire anatomy of the bone, and of course following that the gums as well. And here you can see one mistake I've made, which I somehow repeat over the years, that I have removed too much bone of the lateral incisors. Looks all very nice, and we have a nice line, but the bone of the lateral incisors is just taken off too much. I should have removed maybe 1.5 millimeters less. What is nice, we've polished the root surface nicely, so the problems of gum disease is probably solved for a longer time. Patient brushed well anyway. So in this operation, apical reposition flap, we recontoured the bone. Be careful not to remove too much bone on the lateral incisors, and you can see here everything stitched back, and two-stitch technique, but actually it worked all very, very nicely. And then put in the temporary back is always a test. If we've done a okay temporary, 2 weeks later the temporary will then be readjusted. We just prepare for the teeth, readjust the temporary, and leave that for 3 months to stabilize. And you can see here, this is the situation after 3 months, taking the color. And you can see the consequence of having removed too much bone of the lateral incisors. Central incisor, I should have could have maybe adjusted the gums here a little bit more, but the situation was stable, patient was happy with the results so far. I could have done a little bit better here, adjust the gums a bit further, but yeah, I haven't done it, to my regret now, looking at the pictures. Good. Then repreparation again, taking the impression, digital impression here, and then that's the final situation. Not a bad situation, patient was happy. We could have done a few things differently, but anyway, stable situation, and nice ceramics done by Elena. And then here, of course, we place a Michigan splint to protect our work and, of course, to relax the joints. And interestingly, you can see here, when you have a look, maybe you remember the initial picture of the bone for the front teeth, where the bone was really protruding much. And you can see here the bone after 3 months completely smooth, looks completely normal. So the grinding has reduced and the bone has now its original volume, which it should have done without the parafunction. So I'd like to thank you for your very kind attention. A very classic prosthodontic case combined with a little bit of surgery. So I hope you enjoyed that and learn from my mistakes as well. So thank you very much for your attention, and wish you all nice morning, nice evening, nice day, nice weekend. Thank you very much. Bye-bye.